My name is Christine Spencer, and I'm a research scientist with the Parker Institute for Cancer Immunotherapy. And at this meeting, I'm presenting some results about the gut microbiome, response to immunotherapy, and diet in patients with metastatic melanoma. Our work was done in collaboration with MD Anderson Cancer Center in Jen Wargo's lab. And what we did is we prospectively profiled patients starting therapy, and we took lifestyle surveys as well as gut microbiome samples, and then followed them for therapeutic response. In looking at the data, what we found was that the lifestyle factors, so different types of foods people ate, and also different supplements corresponded both with the microbiome and with therapeutic outcomes. So in looking at the diet and therapeutic outcomes, what we found was that patients who had a high fiber diet were almost 5 times as likely to respond to anti-PD-1 cancer immunotherapy compared to patients with low fiber diets at baseline. We also saw that different components of the diet corresponded to favorable microbiome taxa that we previously identified in a prior publication last year. And what we specifically found was that fiber, whole grains, fruits and vegetables were correlated with more of these beneficial bacteria, whereas foods like processed meats, red meats, and added sugars corresponded to lower amounts of these really beneficial bacteria. We also looked at probiotic intake and saw that almost half of patients were taking probiotics at baseline, and that correlated with lower response to immunotherapy. So about 70% lower odds of responding to immunotherapy if you were on a probiotic compared to patients who are not on a probiotic. And again, this is in a very smaller sample of patients that are going on anti-PD-1, but it's the first result of its kind. So I'm excited to present it at this meeting. So this study was done in metastatic melanoma patients, but we know that outside of melanoma, work from Laurent Siffogel's group and others, especially in colorectal cancer, are also looking at this relationship between diet, the microbiome, and different therapeutic outcomes. So although the work hasn't been done yet, we do think that, again, because we know that diet influences the gut microbiome, that there probably is some component outside of melanoma and other cancer types, although it might be through different taxa in a different mechanism. So next steps include expanding our cohort of patients. So we've been collecting more data on these in the same patient population, trying to validate the results of our initial smaller cohort. Also planned is a clinical trial that's actually going to involve randomized feeding study. So patients will be prescribed different diets, so to speak, before they start anti-PD-1. One of them actually was informed by this study. So a group of patients will be getting a high fiber diet prior to PD-1, and then again following for response to look at the causative relationship potentially between diet and response. And then also we're still working on looking at the microbiome alone and how that corresponds to immunotherapy outcomes. And the Parker Institute for Cancer Immunotherapy, where I currently am, is doing a trial with Series Therapeutics and MD Anderson to look again at causality just between the gut microbiome and response to anti-PD-1 as well as different immune correlates.